Not gonna lie, the COVID numbers are awful. Well, never thought I'd be back here again at Jim R. Miller Park, but the testing facility has reemerged thanks to Cobb and Douglas Public Health here at this facility and several others across the county as the Omicron virus spreads like wildfire. Let's talk with Dr. Janet Memark, the head of Cobb and Douglas Public Health, about how things look.
We didn't think this was going to happen, but here we are at Jim Miller Park again to open a testing site for the current Omicron surge that we're having. Even with as many sites open as we had throughout the county, it hasn't been enough. And so this site is opening today, and we anticipate we'll be able to do a lot of tests out here.
So how bad is it? I mean, let's just cut to the chase. How bad is it?
Yeah, so for Cobb County, yesterday's numbers showed us that we were at 2,468 cases per 100,000 folks. So if y'all remember, anything over 100,000 cases was considered high transmission. So we're at just kind of exponentially high transmission right now. On top of that, of all these tests that we're doing, which are the PCR tests, 34.6% of those are coming back positive. This is one of the highest numbers that we've seen. So a lot of people are sick right now, and it's really causing a lot of havoc throughout the county.
How do you put that into context historically, those numbers?
So historically, when we're looking at our past, let's say 2 or 3 peaks that we've had during the pandemic, this one has just blown it out of the water. The number of cases that we've had has been just truly doesn't compare to what we saw before. Here's what's concerning to me. People have asked, and I'm sure you're thinking about this too, Ross. Symptoms are supposed to be mild, right? So why should we care that, so many people are infected? Well, here's the problem. Even if you have mild symptoms, you still are going to have a small percentage of folks that are going to get very sick and require hospitalization. And when we have this many people, when you look at those first curves, they would have a nice little peak, go up, and have a peak and come down. Omicron came and hit us and went straight up. If you look, it is off the graphs when you look at the DPH sites. That many people sick this fast is causing problems for our structure here.
We've talked too about deaths being a lagging indicator. What are we seeing there?
The lucky thing so far is that we have not seen a huge spike in deaths. Now, we have seen a trickle in of deaths that just have continued. What worries me more right now is our hospitalizations. When we talked to our WellStar folks this morning, they completely supported what we were thinking. The number of hospitalizations that are happening this fast is endangering our health system right now. We've had, over the last 2 weeks in the state of Georgia, we've had over 500% increase in COVID hospitalizations. And over the last 7 days, it's been a 100% increase. Kennestone and Cobb tell us that they are at 3 times and 4 times the levels of COVID patients just in the last few weeks. So this amount of patients that are being admitted so quickly is straining the health system. You can look, and when you look on that, the Georgia Coordinating Center, you can see that all of the hospitals are at severe capacity, and we're on diversion this morning, diversion across the board. And so this is a danger to us, and we really need to slow this down at this point.
One of the things that was showing up as a bad trend early on is that this is affecting more younger people than the other variant.
Yeah, so we are seeing that. Now, the good thing is that most of them do better, but we are seeing several 100% increases in our childhood, in our school-age children, our 0 to 4 children. So this is quite a problem. We have a lot in 18 to 22. They have increased by 200, 300% in cases over the last few weeks. The good thing is that usually they do okay, but we saw a lot of more younger folks being hospitalized. So we are seeing higher numbers of hospitalizations for children and for young folks. We are seeing an increase in over 80-year-olds as well, showing that our vaccines probably are waning a little bit, and that's why it's so important to get your booster at this point.
Speaking of boosters and younger people, there's been a couple of changes.
A lot of changes have come through very quickly. So first of all, anybody 16 and over can get a booster shot. So you can get your Pfizer. Everyone is recommended to get a booster shot. And so it will provide you more protection against getting COVID, but also, even if you get it, against hospitalization and death. So it's very important. Recently, the FDA approved 12 to 15-year-olds to also get the booster, and anybody over 5 that have severe immunocompromising conditions also are recommended, and they want to decrease the interval to 5 months. Those recommendations have been made. The CDC has to take up those recommendations and adopt them, and then the DPH, Georgia DPH, needs to give us our instructions. So all the instructions on how to do this, paperwork, everything, and that should be coming soon. So please stand by, and that'll come out soon.
So speaking of the younger folks and the boosters, schools today are back in place. Again, what advice do you have about how to deal with this Omicron in school?
So the number one thing I can recommend is that teachers and staff and students get vaccinated. It is very important if you want to not roll the dice on whether your child is going to have a severe reaction to COVID-19. So it's important to get vaccinated. But as you go to school, it's important also to wear your mask and not come to school if you are sick. This is not the time to say that you have allergies or stuff like that, okay? This is a time when you're thinking Omicron first. So yes, masks are not 100% protective, but during this time we need to slow it down as much as we possibly can. So please have your kids wear a mask and get vaccinated at this time. It'll only be a few weeks, and then we anticipate Omicron will go back down, and then maybe we'll get back some of our lives.
Here we are, Jim R. Miller. Testing is resuming here again, and I think during our last conversation, we discussed a little bit about who really needs to come running out and getting these tests. What are you seeing at these testing sites, and what do you tell people about when to go get a test?
Yeah, so, it's important. There are people that actually have to have a test to do certain things, to have your results. So whether that's for work, for travel, or anything like that, you have to have proof so that you can go back and make a living. Those people really need to have those tests, right? If you can get a test and you were showing some symptoms, you are a contact to somebody or something like that, and you need a test, then albeit, it's a great idea to get a test if you can. Now, if you can't get a test, and hopefully it's better this week because we've added so much testing, if you can't get one and it's going to be 5-8 hours waiting for a test, then you can hold off. You can hold off and just act like you have COVID at that point. If you were a close contact and you developed symptoms, you probably got it at that point. So I would go ahead and isolate yourself. But hopefully we got more tests available so you can go ahead and get that test as you need it.
So you said you talked to the hospitals earlier. You guys have been dealing with this for a long time. I imagine the burnout level is high, and people are also getting the Omicron variant. So how do you keep operations going?
It's a good question. So we actually had that discussion today. We have a lot of people that are positive in our agency as well. And so, it's a fine balance that you have to walk. But one of the things that, we tell our agency and to other people, if you can go virtual for a while for your meetings or coming into work, just for the next few weeks, it would help tremendously. Don't unnecessarily gather. Make sure if you have any symptoms, please don't go to work or to school like that. You're just going to expose other people. If you have to go, try to spread yourselves out, wear your mask, wash your hands, and just do things like that. Make sure everybody's as vaccinated as you can get. But otherwise, we're all trying to keep all services going, but it is a strain. It's a strain on all of us that have to deliver services on a needed basis. So, we're all kind of getting through, but we do need your help.
Last question. You mentioned the graph earlier, and you look at it and it shoots straight up. It almost looks overwhelming, and you almost want to bury your head in the sand and just not even look at that anymore. Just, having been doing this for a couple of years now, personally and your staff, how do you rectify that and deal with it?
Well, my silver lining in all of this is it went up really fast, and we pray that it comes down really fast as well. And so I tell my staff, as you should all as well, do some self-care. Make sure you take care of yourselves. And during all of this kind of stress is very difficult for everybody. But I pray it's short-lived, and that's what I hope for everybody, that we all can remember. Let's just do our part just for a few weeks, and this should pass over. And it should be shorter than the other surges, which I think is good news. So please, let's all just work together and do what we can.